Did you know that over 6 million Americans suffer from heart failure and that number is expected to increase by 2030? That is a staggering statistic, but the good news is that there are techniques to help reverse heart failure and enhance your heart's health. Heart failure is an illness that affects millions of individuals worldwide, in which the heart weakens and is unable to pump enough blood and oxygen to the body's organs. It can be caused by a number of reasons, including excessive blood pressure, coronary artery disease, and heart attacks. This video will teach you about 7 techniques to assist cure heart failure, as well as medical procedures such as drugs, implanted devices, and surgery. You'll also learn about various heart failure therapies and how to manage other health concerns. By the end of the film, you'll have a better understanding of how you may enhance your heart's health and potentially reverse heart failure. There are various myths about reversing heart failure. Some individuals feel that heart failure is a permanent ailment that cannot be reversed. Others say that heart failure primarily occurs in the elderly and that young people should not be concerned. Some people also assume that heart failure is solely the result of poor lifestyle choices, such as smoking or eating unhealthy foods, and that there is nothing they can do to reverse it. However, there are techniques to reverse heart failure and enhance heart health. Adopting a healthy lifestyle entails eating a balanced diet low in salt and fat, obtaining regular exercise, quitting smoking, and limiting alcohol intake. By adopting these modifications, you can enhance heart function and lower your risk of heart failure. Exercise, for example, can help strengthen the heart and increase blood flow, while quitting smoking can lower the risk of heart disease. A nutritious diet can help lower blood pressure, improve cholesterol levels, and reduce inflammation, all of which are essential considerations for heart health. It is critical to take prescription medications exactly as advised if you want to reverse heart failure. These medications act by increasing heart function and managing symptoms. ACE inhibitors, for example, help to relax blood vessels and lower the burden on the heart. Beta blockers lower the heart rate and reduce the force of cardiac contractions. Diuretics aid in the removal of excess fluid from the body, lowering the stress on the heart. Blood thinners help prevent blood clots, lowering the risk of heart attack and stroke. It is critical to take these drugs exactly as prescribed and to visit your healthcare professional on a frequent basis to assess their effectiveness. Implantable devices, such as pacemakers and ICDs, serve an important role in regulating cardiac rhythm and increasing blood flow. Pacemakers help control the heart rate and rhythm, ensuring that the heart beats at the proper rate. ICDs monitor the heart's rhythm and, if necessary, shock the heart back into a normal rhythm. These devices can provide essential support to patients suffering from heart failure, lowering the risk of heart failure. Your healthcare professional can advise you on whether an implanted device is right for you and what type of device would be best for your individual condition. Managing other health issues is critical in reversing heart failure. Many medical disorders, including high blood pressure, diabetes, and sleep apnea, can lead to or worsen heart failure. That is why it is critical to manage these illnesses to lower the risk of heart failure. This may entail taking medications as indicated, adopting lifestyle modifications, and seeing a healthcare practitioner on a regular basis to monitor your condition. For example, if you have high blood pressure, you may need to take medications as well as make modifications to your diet and exercise routine. If you have diabetes, you may need to control your blood sugar levels with food, exercise, and medication. Hey guys, if you liked the video, please like and subscribe. It will help you to reach more people and promote awareness. Now, let's return to the video. Following a heart-healthy diet is also important in reversing heart failure. A diet low in salt and fat and high in fiber, fruits, and vegetables can assist enhance heart health. Because salt causes fluid retention and raises blood pressure, persons with heart failure should follow a low-salt diet. A diet rich in fiber, fruits, and vegetables, on the other hand, can assist improve heart health by lowering inflammation, cholesterol levels, and blood pressure. Working with a healthcare professional or a nutritionist to design a balanced diet that suits your needs while taking into account any other health concerns you may have is critical. Regular checkups and monitoring are critical in controlling heart failure since they can spot any changes in your health early on. This enables healthcare providers to modify treatment strategies and guarantee that you are receiving the best possible care for your heart failure. During checkups, healthcare practitioners may also do tests to monitor heart function, such as electrocardiogram (ECG) or echocardiogram, and look for any changes in your condition. Reducing stress is also crucial in controlling heart failure because stress has a negative impact on heart health. There are several strategies to alleviate stress, including deep breathing and meditation, regular exercise, and spending time with loved ones. These exercises not only assist to decrease stress, but they also promote heart health and lower the chance of heart failure. It's critical to figure out what works for you and incorporate stress-relieving activities into your everyday routine. Each of these procedures has advantages and disadvantages, and it is critical to consult with a healthcare expert to identify the best option for you. Prescription medicines, for example, can be beneficial in improving heart function and reducing symptoms, but they can also have adverse effects that must be monitored. Adopting a heart-healthy diet and lowering stress, on the other hand, may have fewer negative effects but take longer to show results. When examining numerous choices for reversing heart failure, it's critical to assess the benefits and drawbacks and make an informed decision in consultation with a healthcare expert. It's also crucial to remember that different ways may work better for different people, and what works for one person may not work for another. So, what are your thoughts on this? Let us know in the comments. Remember to show your support by clicking the like and subscribe buttons. See you in the future video.